If you want to better understand what's going on with healthcare, Digital Health Review is the podcast that brings relevancy into the health technology conversation. Digital Health Review presents stories of health equity and technology, as well as actionable advice and news at the intersection of digital health, public health, and health equity. I'm Blair Hurst, your resident Black health tech nerd and host. In this episode, we continue our conversation with Dr. Sara Chokshi. We have a very in-depth discussion about how are we going to measure the public health impact of digital health tools at large. Are there potential building blocks that we can equip digital health founders with so they can bring digital health design development to their work, or a roadmap for development so that we can make sure that we're measuring impact from the beginning? Additionally, are there ways for us to improve the research infrastructure to make it more adaptable and ready for iteration and agile building in digital health? I'm happy for you to join us. Let's get started. One thing that I'm also, ruminating on is the fact that the impact for these companies can have, because they are building solutions that essentially have no borders, and can be disseminated to the population at large quickly, is that they are greatly impacting public health. And I'm not sure how we are going to track the impact of this work across the public health sphere. So what I mean by that is, there's an onslaught of mental health apps, for example, in healthcare companies. And the work is needed, obviously. And but the impact is quite large. And so, how are we building the solutions? What are they doing to the public's health status? And what are we measuring it against? And what are the levers that we're going to say are, yes, we need to continue down this path, or no, we don't need to continue down this path, or pivot. So in my mind, and in the perfect world, which I know not every company can do, there will be at least some arm in the company that is evaluating their impact to public health or doing some level of public health research. And I'm curious about what your thoughts and opinion are about, what is fundamentally true about, public health impact and research in the digital health ecosystem.
That is an amazing question. And I think it, what comes to my mind, it kind of builds on what you're saying. I think mental health is a great example. We have so many options now, and they do some of the same things. They do some different things, and then they do some of the same things differently. And then there's the problem of, not problem, but, then there's who's measuring how, what kind of impact they have. And they're startups with, limited budgets. And so how well set up are they? And, depending on who they have on staff and their capabilities, how set up are they to evaluate, that impact, from, again, like from a public health standpoint. And, I think this is somewhat the job of the startup, but I also think this is the job of public health. Like, I'm not really involved in much of this kind of work right now, but, like, I think some of the, I think there are some academic departments that are well set up and are doing that, and some groups as well, like a Node Health, for example, like, who are well set up to kind of tackle these problems. And I'm going to get to my point here, which is I see it, but I think more and more like we need to start thinking about these kinds of solutions not as separate, but really, and even the solutions themselves and the startups themselves, really honing in on what's our special sauce. What are the evidence-based practices that we are, sort of evidence-based interventions that we are using, cognitive behavioral therapy, for example, right? So we know cognitive behavioral therapy is good. It can, work wonders, super, for, for this particular condition. Okay, great. And we know that we have some evidence on delivering that digitally and what that should look like. And we have some evidence on like sort of how it works best. But, we need to be super careful now and sort of design studies that examine, how can we really dig in deep, because all of these solutions are different, but they're not completely different. There's elements of special sauce in there, and we need to be tasting all the sauces, measuring them, and kind of figuring out what combination of flavors, is really having the best outcomes for who, because it's not going to be the same for everyone, right? I was just reading, someone posted an interesting article about like, and I'm not saying I necessarily like vote for this. I can't say that, but it was kind of like, hey, people, mindfulness is not going to solve the teen mental health crisis. They don't stick with it. It's boring. Whereas if you're a middle-aged lady like me, mindfulness might be your way to go, So we really need to think of also, and it's the same thing from like a cultural aspect. Really think about what combinations of flavors can CB, and like digital flavors, can we deliver this intervention that we know works, that makes it sticky, that makes, that increases adherence, that gives people great outcomes. You know what I'm trying to say? It's like,
I know exactly what you're trying to
yeah.
say. And this is, so my master's degree is in innovation and technology management. I got it at NYU's Tenon School of Engineering.
Oh, sure.
And it was also interdisciplinary between the engineering school and NYU Stern School of Business. So business basics with the innovation twist. And the reason why I decided to get that degree was because I was working in healthcare quite some time. I was working in product, building solutions for patients and providers. And I became obsessed with the idea that I'm tired of building things that fail or don't get adopted when the solution is could be extremely effective. And so, innovation has, for some folks, been, first of all, the word has been overused.
Yeah.
But innovation for some folks can feel like this mysterious cloud of, only the Steve Jobs and Elon Musks of the world, who are geniuses supposedly, can create things. And I always disagreed. And I said, this is a formulaic process. I'm sure it has to be, because there are patterns in successful companies that we know who are extremely innovative. And those patterns are consistent, or can be fairly consistent, regardless of the industry, right? And so how can then we think about new product development or creating new business ideas in a way that hones in on the fundamental skills needed to build, and then replicating that, right? So we're all, folks in my industry are familiar with design thinking, agile lean thinking, lean startup thinking, because it's a process that helps folks research and discover the pain points and come to a solution and iterate upon that solution. And so that, it resonates what you were just describing, because I think you're saying the same thing, in the sense of, if we're looking at a sector, or if we're looking at a slice of digital health, cognitive behavior, digital therapeutics, if we're looking at neurological conditions, and there's a host of companies trying to solve for these things, what is effective at a minimum, at a base? Who are the companies that are getting success? And so if we want to have solutions at large, let's better support new founded companies by giving them a roadmap of where they need to start and the fundamental things that they need to have in order to be successful. I wholeheartedly agree with that thought process.
Yeah, no.
I'm happy to think about it some more and challenge that, but I do believe that is the area that we need to start looking at You know,
You
there's
know, I mean,
a whole lot of literature around tech stack development. There should be a lot of literature around digital health design development.
yeah, and you know, I think it's like kind of there, but it you know it's sort of off, a little bit off on its own. But you know, I mean, when I discovered design thinking, I've you know, it was like, you know, the sky opened up and the sun shone. I mean, it's so um it's so helpful, and it's, you know, it's interesting. I have a couple friends, like if you're my like my area of expertise, if you will, when I was in school was qualitative research methods and measurement. And, you know, like, and coming from public health is, you know, as, as you might be familiar, it's like, you know, it's very much rooted in the same stuff, like this very, you know, anthropological, community-based approach to designing programs. You know, we were always designing interventions, designing programs. Um, and but it's like this similar ethos, right? It really knowing what the needs are, who the people are, you know, what their perspective on their, you know, quote unquote, um, issues are. And um, you know, that along with, I have a quality improvement background from when I was at the health department, this idea of continuous quality improvement, which is
Mhm.
very incremental. So it's like, you know, kind of like not so exciting now, but back then it was that first taste of, you know, this idea of iteration, this idea of test and learn, of, you know, put something together, test it out, get some feedback, make it a little better, try it again, you know. And I think it's been so hard, you know, coming from being in an academic for environment for a while that was dependent on NIH funding. You know, it was like crazy because you want to do research and you want to sort of build a digital tool for your research project, but then you have to go for institutional review board
Mhm.
approval. And so you're like, you build something, you say what you're going to build. Um, you have to say what you're going to build before you even get the money. By the time you get the money, you know, things have changed, but you can't change what you were going to build because that's what you said you were going to build. And then while you build it, you're not allowed to change it, because if you change it, you'll have to go back to the institutional review board, and that's going to take months. You know, so it's just not built. The infrastructure in research, you know, I think it's getting better, but it's just not built um, for iteration, which is really hard when you're trying to do these things that we're talking about, which is, you know, really be agile, be nimble, and work within an agile framework. You know, and the way we tried, you know, the group that I was with, the way we tried to solve for that was, you know, kind of introduce that idea of, you know, what's the like active ingredient that we're testing here, and that won't change. But you know, these we were trying to sort of allow ourselves room to change these, you know, bits of kind of bits around how that active ingredient would be delivered, you know, technologically, in a way that kind of freed us up for this experimentation. But it was really hard, you know. um,
Yeah.
and yeah, and I have to say, like, I think your background's really great, because the other thing, I always love working in groups with people who are outside of healthcare. I as in healthcare, love working with groups on healthcare problems when they're not from healthcare, because they think everything I say is like amazing. And then I feel the same. I love working with groups outside of healthcare on healthcare problems, because they have all of this kind of like applicable knowledge and experience, like I would never dream of bringing in, because I just don't have that, you know?
Yeah.
So, you know, I think that cross fertilization, bringing in ideas and expertise and approaches, you know, like design thinking,
Yeah.
to healthcare, like that really jumpstart things, and kind of, you know, stir up the pot.
Absolutely. And one of my favorite books from grad school and I'm actually pulling it up now. The nerd that I am, it's right next to my desk. The 10 Types of Innovation, the Discipline of Building Breakthroughs by Larry Keane. It breaks down innovation models that are industry agnostic. And the examples that they do give inside of the book, you can see being applied across different industries. But to that point of healthcare is complicated. Those who are in healthcare have a very unique knowledge set, but those who are not within healthcare also have a unique knowledge set. And if we can use each of those unique knowledge sets as building blocks, we can interchange them in a way to find that, I wouldn't say anything's magic or the sole solution, but to find solutions, plural, that work well. And, I highly recommend for you to take a look at it. But I'm also curious from you too, like, are there books that you've read that you would recommend to myself or our listeners that you think would be really important when thinking about sort of design thinking and research in the healthcare space? Or just in life?
Yeah, I'm trying to think of the kind of the better things I've been reading lately. There's a book called Possible Minds, which is a bunch of it's like a collected book of essays. It's a few years old now. Just different perspectives on artificial intelligence. That one was really cool.
Thank you for joining us. If you'd like to subscribe to our newsletter, shop the latest digital health products, or listen to more episodes, please go to www.digitalhealthreview.com.